Good afternoon. Today we are going to discuss benign prostatic hyperplasia. So we'll start with what is it? This condition is more commonly known as BPH, and it is a non-cancerous enlargement of the prostate gland found in men. If it's not treated, it can cause bladder, urinary tract, or kidney problems. The enlarged prostate can pinch off the urethra, which is the urine's exit path from the body, and it can cause urine flow to be blocked. The prostate is a gland that is part of the male reproductive system, and it surrounds the urethra, sitting just below the bladder. Here's a picture of a normal prostate versus an enlarged prostate. The yellow in this picture is the prostate gland, and you can see there's enough room for the urethra to flow through. And here the prostate is orange and red and inflamed and swollen, and it's pinching the urethra off, meaning the urine is going to sit in the bladder, which can cause bladder infections, urinary tract infections, and so on. So some of the symptoms, the severity of the symptoms varies from patient to patient, and just like with most diseases and conditions, not every symptom occurs in every single patient. It's a case-by-case basis. But the most common symptoms that are seen are frequent or urgent need to urinate, increased urination at night, difficulty starting urination, a weak urination stream or a start and stop stream, dribbling after urination, the inability to completely empty the bladder, unusual color or odor of urine, and pain during urination. The causes are not well understood, and there are a number of theories as to what actually causes BPH. Some believe that it may be related to aging and the testicles, while others believe that increased amounts of certain hormones in a man's body later in life may trigger the extra growth. Some of the risk factors. Age is a main risk factor for BPH. The older a man is, the greater his risk of BPH, and up to 50% of men can show symptoms by the age of 80. Family history also plays a part, so having a blood relative who has BPH or other prostate problems can put you at greater risk for BPH. Diabetes, the excess insulin triggers the liver to make insulin-like growth hormone, or IGF, which is believed to trigger the extra growth in the prostate gland. Obesity, men with extra body fat also have higher levels of estrogen, which can make the prostate grow larger than normal. The diagnosis process. So first the doctor would look at your family history, your family medical history, because as we stated before, a risk factor is family history and having a blood relative. So first you would look into what issues they had, if they had any prostate problems. Next, it will be a physical exam, which is a digital rectal exam. There's a picture here, and this is when a doctor puts on a glove and puts a finger in a male's rectum and feels for the prostate gland. They can feel the enlargement for BPH, or if they're looking for cancer, or even if they're not, if they can find nodules, they can find bumps, they can find cancerous growths. So this is the main way that prostate problems are diagnosed is through the digital rectal exam. Then some medical tests they use are urinalysis, prostate-specific antigen blood test, urodynamic test, cystoscopies, transrectal ultrasounds, and biopsies. The prevention. The prevention for BPH is prevention of the risk factors that you can control, not prevention of BPH itself. Since the cause is unknown, you're not able to prevent BPH specifically. You have to prevent these risk factors that you can. So exercise is the main prevention. This helps to prevent diabetes and obesity, which can both lead to BPH. And the activity also helps reduce inflammation in the body, and it makes insulin use in the body more effective. The treatments for BPH, they are 4 categories: lifestyle changes, medications, minimally invasive procedures, and then surgery. So you'd start with the lifestyle changes and then eventually go down to surgery if necessary. The lifestyle changes include avoiding or reducing caffeinated beverages and alcohol, avoiding or monitoring the use of decongestants, antihistamines, antidepressants, and diuretics, training the bladder to hold more urine, and exercising pelvic floor muscles, which are known as Kegel exercises. The medications used are alpha blockers, phosphodiesterase 5 inhibitors, 5 alpha reductase inhibitors, and combination medications. Minimally invasive procedures. There are a number of minimally invasive procedures that are used for BPH, and they mostly use stents or heat to destroy the prostate tissue so it will go down to a smaller size, or to stretch the urethra to allow the urine flow to start again. And then surgery. The one of the more common surgeries is transurethral resection of the prostate, TURP or TURP. And this is when they go in and they actually remove tissue from the prostate to bring it back to a more normal size. Laser surgery, open prostatectomy, and transurethral incision of the prostate, which is TUIP. This is a less invasive procedure than the TURP, and none of the tissue is actually destroyed. But where the prostate and the bladder meet, they go in and cut the muscle so that the muscles are more relaxed and that the urine flow can start again. So now we'll do some teach back. So the first question that I have is, what can occur as a result of BPH if it is not treated? So the things that can occur are bladder, urinary tract, or kidney problems. And these are a whole list of things that can occur as a result of BPH, but they affect the bladder, the urinary tract, and the kidneys. What are the 4 main risk factors for BPH? These are age, family medical history, diabetes, and obesity, with diabetes and obesity being the only ones that can be somewhat prevented. What are the treatment categories for BPH? These are lifestyle changes, medications, minimally invasive procedures, and surgery. And they will go in that order. So you start with lifestyle changes, and if it doesn't help, go to medications and so on and so forth. So least invasive to the most invasive procedure possible. So thank you for listening to my presentation on BPH today. I hope that it was helpful, and I hope that you learned a lot.